Maayong adlaw na tong tanan. Are you having difficulty using your hand after a stroke? If you do, then you need to watch this video. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. After you have a stroke, it is very difficult to use your arm and your hand, right? Your first goal is to regain muscle control. After you have that muscle control, now you want to get that arm and hand stronger. So, if you have not watched the video, I have a video on how to strengthen your arm. Not with your hand yet, but your arm. Click on this link right here. Getting your hand to get stronger might take a little longer than the rest of your body. That is because the muscles there are smaller and thinner. They're very slender. But there are exercises that you can do to strengthen your hand and to improve that grip and ability to use that hand again. Before we get started, let me put a sleeve on my hand so that you'll know which hand will be the stroke hand, okay? Now let's start. First, let's try to mobilize the joints of your stroke arm. So again, my stroke arm will be my left side, the one with the sleeve, okay? First exercise will be just turning your forearm, facing up and facing down, okay? Let's do 10 of these, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, if you have difficulty doing that first, you just roll that forearm, okay? So just like this, all right? Just guide your stroke arm with your good hand, all right? So that is forearm turning. Now let's mobilize your wrist, all right? So you're going to hold or grab your hand, your stroke hand with your good hand at the base of your hand. So first we're going to bring it up and down just like this, all right? So just 10 times, going up and going down, all right? Let's do it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we're going side to side because we also need that mobility of being able to go this way, right? So let's do 10 side to side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And this is wrist mobilization. Now let's mobilize the bones that are located in the middle of our hand, okay? We also need to mobilize them. Yes, there are bones there and there are multiple ones there. Small bones like pebbles, pebble size, okay? So we also need to mobilize them. Put your fingers right here towards the middle and your thumb close to the wrist, just above the wrist, okay? Just like this, look. All right, your thumb, you're going to push down and your fingers are pushing up towards the hand, okay? So just like this, see? All right, let's do 10 of these and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we're going to move your thumb towards your knuckles, all right? Right there, towards the knuckles, and move your fingers towards your wrist, just slightly above your wrist, okay? Again, push your thumb downwards and your fingers upwards towards the hand, all right? So it will make your fingers move. It seems like your fingers are moving, but it is not. All right, so let's do 10 of these, all right? And push down with the thumb, fingers pushing upwards towards the hand, all right? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is the middle of the hand mobilization. Next will be the fingers. We need to mobilize their fingers. Try to grab or hold at the fingernail area, the tip of your fingers. Let's start with the thumb, and we're just going to go circles like this, all right? Just like that. So we're going to move the thumb first in circles. Do 10 rounds, okay? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's do the rest of the fingers. Index finger, circles, circles, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, middle finger, circles, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Ring finger, circles again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then your little finger, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, and that is finger mobilization. Now let's start with strengthening your hand so that it will function better, so that you're able to use it better, right? So you should be able to close your hand, make a fist, and open your hand fully like that, okay? So let's start with the ability to close our hand so we can hold on to the things that we need with our self-care, with our day-to-day activities, okay? So let's facilitate the ability of the hand to close. So what you want to do, you're going to rub your hand towards the fingertips with your good hand, okay? So just rub it like that multiple times, maybe 10 times, all right? And then try to close that hand, all right? It will facilitate the ability for it to close. Do that around 3 rounds. All right, then close. One more time, rub it 10 times. 3, 4, 5, 6, 7, 8, 9, 10. Then close. Now to strengthen the hand to close, or to make a fist, to strengthen your grip, you don't need any special equipment. Just try to open and close your hand. Okay, just open and close your hand like this. First, neutral position, or with your arm towards the front 10 times. 4, 5, 6, 7, 8, 9, 10. And then with your arm facing up or pointing up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then with your arm towards the side, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. This is very effective. Trust me, you will feel your forearm burn after doing these exercises. And that is how you improve your ability to close your hand and improve your grip strength without any equipment. Now, most of the time, we are so concerned about being able to hold on to something. But equally as important is the ability to open and release items. And most of the time, you will see this. Your stroke hand will close more easily than be able to open it, right? So let's try our best to strengthen the muscles that will open that hand. It is more difficult to gain that strength of opening that hand. So let's try to facilitate that, okay? So to facilitate it, again, we're going to rub, just swipe it up like this, from the wrist towards the fingers. So just rub several times, 10 times, then try to open your hand, okay? Let's do that a second round. 2, 3, 4, 5, 6, 7, 8, 9, 10. And try to open that hand, all right? One more round. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Open that hand. All right? And that's how you facilitate the opening of your hand. Now that we have facilitated the ability of that stroke hand to open up, we are going to strengthen the muscles that would allow your hand to open and release items that you are holding. Okay, so the first exercise, you are going to put your hand on the table. So bring your fingers together, including your thumb, then try to open it up. Just slide your fingers from the table. All right, open and spread your fingers and then close them. If they are still weak, you can just go as far as you can go and then guide your fingers to spread further, then bring them back together as close to each other as possible and then guide them as well. All right, let's do 10 of these. All right, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, next exercise. You're just going to put your arm on the table, all right, supporting the elbow on the table and from a neutral position, so your hand is not in a fist. You're going to open your hand from neutral position, okay, just like this. Go as far as you can. All right, now if your hand will curl up, if it is tight in the fist, just try to open it as much as possible, okay, just like that. Don't be frustrated, be patient. It is just like being a baby again. Those brain cells are back trying to reconnect. There is an injury to your brain after a stroke, so it's trying to reconnect. So again, let's try to open your hand and close your hand. All right, open and close. Let's do 10 and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, you will feel your hand getting tired. Trust me on this. The back of your hand, you will feel it. Also here in your forearm, the back side of your forearm, you will feel it burn. Okay, so first exercise again was spreading your fingers and then just sliding it from the table, spreading your fingers and then bringing them back together. Then next is this one, right? The next exercise will be more difficult, but it is necessary, okay? It will not only improve the strength of your fingers, it will also improve your coordination. So what I'm talking about is to lift individual fingers off from the table, okay? Lifting it up, just like that. All right, let's start with your thumb, index, middle, ring finger, little finger. Let me slow down a little bit if you have a hard time. All right, thumb, index, middle finger, ring finger, little finger. Now, if you have a hard time doing that with your fingers apart, you can also just bring your fingers closer together. All right, again, let's do your thumb, index, ring, middle finger, sorry about that, ring finger, middle finger. One more round. Let's do your thumb, index, middle finger, ring finger, and little finger. Again, like I said, this will improve your coordination. This is challenging even for me. One more round, okay? Let's do this. And thumb, index finger, middle finger, ring finger, and little finger. All right, so that's your finger mobility exercises. All right, so those are the exercises that I would suggest that you do in a daily basis to improve your hand strength, the ability to make a fist or hold on to objects and release things that you are holding. Those are equally important components of your hand function. Okay, you also need to have that coordination. The last exercise again was the individual finger lift. Okay, so I hope that I was able to help you regain your hand function, your ability to hold onto objects and release objects. Now, if you have any questions, suggestions, recommendations, and even reactions, just type it down below. Please give it a thumbs up if I was able to help you, and let's help spread this video to those who really need it, especially those who have a stroke or even with traumatic brain injury. This will help them. That will help the algorithm spread this video and help them out. Now, if you have not already, just click on that subscribe button. Please click on that subscribe button so you will know when there is a new video, including that bell, the notification bell, okay? So again, just a reminder, consistency is the key and never give up. Until next time, paalam!